All right. Hey, so it's Dr. Neal. I want to talk you through just a few things that can help with your lower leg. This is really common if you do a lot of exercise, if you're do a lot of repetitive stress, especially if you're on cement surfaces quite a bit. The lower leg can get irritated and sore, and it's something that doesn't get a lot of attention. So we're talking knee to ankle, essentially, and then down into the foot. And so what happens is when you look at the actual leg itself, you have the foot and then the tibia and then the fibula. And there are over half a dozen muscles that come from the side of the leg down into the foot that help you to push off. So there's quite a bit of muscle all along the sides of the legs, and they tend to be muscles up top along the leg and then tendon down into the foot. So there's long tendons on these muscles. And so we need that. And then so there's a muscle belly might start here up at the side of the leg. Muscle belly comes down to the lower part of the bone, and then a long tendon all the way down towards the toe or towards the ankle. And so these tendons can easily get irritated. And then because there's multiple tendons that come down so that you can push off, there's another large tendon called a retinaculum that just lays over top. And what it does is it holds those tendons tight to your foot so that when you push off, it gives you extra leverage. So all of that can get irritated and can get sore from lots of pounding, repetitive use, cement floors, that type of thing. So a simple way to work these muscles, because they don't get worked very well. Most of the time, they just get left alone. If, at best, you might stretch your foot or your ankle. But a simple way to work with this that helps really well is get like a wooden spoon or a wooden spatula. I've had people use like the percussion machines, like the impact machines, but it seems not to do the same thing. That can loosen up the muscle, but it doesn't quite help the tendon the same. So what you want to do is you get like a wooden spoon or a wooden spatula, and you're going to work the sides of your legs. You're going to put pressure in and down, and you're just stripping the muscle. Anywhere where you find that it's sore or it's tendon or tender, you can really just sit on that spot and work that spot really well. And then when you get down into the ankle or the foot portion of it, you can really get down and you're stripping those tendons. You're just stripping away. Again, anything that's sore or tender, just sit on it and work at it a little bit. And it really starts to strip those muscles and it gets them to loosen up so there's not so much tension. And as you start doing that routinely, you can notice that you're going to see freedom of motion in the leg and the ankle. These muscles won't be near as sore, and it will really allow you to train harder and longer without so much irritation or wear and tear. So it can do quite a bit for you, or just have days where maybe you're working and walking and standing quite a bit where it's not near as sore. So you want to work the inside of the leg down to the foot and out, and then the outside of the leg down to the foot and out. And then you can just get right on top and work the retinaculum and some of these ligaments right here along the top. That's what you're essentially trying to do. So if I was doing that with my own foot, just to kind of give you a feel for what that looks like, I'll have my foot up here, and I'm just essentially trying to work the inside of my leg, and I'm just stripping along here. If I find anything that's sore or tender, I'll work it. I really will dig in around the ankle joint itself and then come down to the foot just a little bit. But a lot of times you're stripping the sides, and where you find it tends to be most uncomfortable is just above the ankle. That's where it goes from muscle to tendon. Those are the areas that really need to get worked. But if you get these tendons to loosen up, and then you got to work the muscle. So you want to work the sides of it. You're doing inside and you're also doing the outside. And you want to work that muscle belly because it loosens that muscle belly up. You get down into the tendon, you feel it sore, and then you work it down. As you're doing that, again, you'll find it loosens everything up. It improves mobility and just your workout or your work ethic. So that makes a big difference, along with strengthening the muscle with toe raises and ankle exercises, and then any sort of stretching or flexibility. So if you have questions, please let me know. Otherwise, I hope this helps.